we are going to look at the malabsorption syndrome and specifically the investigations. Before we start, some questions. The first one is, in terms of the carbohydrate malabsorption, comment on this. And the second one is, comment on the pancreatic insufficiency. So in this video, we'll find the answers to these questions. So to begin with, first we are going to look at some common disorders, some general tests. Some general tests in the malabsorption. So it includes, first it is the fat malabsorption. And under fat malabsorption, the investigations, it includes the quantitative. So under quantitative, there is a 24-hour fecal fat, 24-hour fecal fat greater than 7 gram. And after this, there is also the qualitative. So under qualitative, there is a Sudan 3, the Sudan 3 staining. And after this, there is also the C14, the C14 trioline breath test, the trioline breath test. And after this, there is also the fecal steatocrit. So just to recap, we saw the malabsorption syndrome, and that we are looking at the general test. So firstly, there is a fat malabsorption. So under this, there is a quantitative, that is 24 hours of the fecal fat, 24 hours of the fecal fat greater than 7 grams. And then when you look at the qualitative, it includes the Sudan 3, the Sudan 3 staining. And there is also the C14. C14 is the trioline breath test, as well as there is a fecal steatocrit. So now we'll be going ahead with another one. So we covered the fat malabsorption. Now what we have is, we are looking at the carbohydrate malabsorption. So under the carbohydrate malabsorption, there is the D-xylose, test. It includes the D-xylose test as well as the lactose hydrogen breath test. It includes the lactose, then the lactose hydrogen breath test. Next, we'll move on to the protein malabsorption. So under the protein malabsorption, this includes the C13. It includes the C13 egg white breath test. So let's recap. So we saw the carbohydrate malabsorption. So this includes the D-xylose test as well as the lactose hydrogen breath test. Then when we look at the protein malabsorption, this includes the C13 egg white breath test. Now these were the general tests. Now we'll be looking at some of the specific investigations. So now we'll move on to the specific investigations which has done. So this includes, firstly, there is a celiac disease. So under the celiac disease, the investigations, it includes the anti-tissue. And this is the anti-tissue transglutaminase. So the anti-tissue transglutaminase, this is nothing but the it is the anti-TG. Next, we also have the anti-endomysial antibodies. Next comes the mucosal. So all this comes under the celiac disease. So next is the mucosal biopsy. So mucosal biopsy, and what does it show? Showing the villus atrophy. So mucus biopsy showing the villus atrophy, as well as a crypt hyperplasia, then the lamina propria infiltrates. Next, it also includes a normal mucosal thickness. Now let's just recap. So here we have seen the specific, we have entered the specific test, investigation. So under the celiac disease, there is an anti-tissue transglutaminase, that is known as the anti-TG, and also the anti-endomysial antibodies. Next, there is also the mucosal biopsy, and the mucosal biopsy, you see, it includes the villus atrophy. It includes the villus atrophy, then the crypt hyperplasia, then the lamina propria infiltration, as well as a normal mucosal thickening. So then we move on to the Whipple's disease. We have the Whipple's. So what does this Whipple disease do? Whipple disease, the investigation is the mucosal biopsy. So you give a mucosal biopsy. So mucosal biopsy, and what does this show? This shows a PAS. It shows a PAS positive macrophage, PAS positive macrophage. So it's a PAS positive macrophage in the lamina propria. In the lamina propria. Then we look on to the pancreatic insufficiency. So under the pancreatic insufficiency, it includes the fecal elastase. It includes the fecal elastase as well as the fecal chymotrypsin. So let's recap. So here we have the Whipple's disease. So under Whipple's disease, there is a mucosal biopsy, and we have the PAS positive, that is a macrophage in the lamina propria. Then when you look at the pancreatic insufficiency, the investigations is the fecal elastase as well as the fecal chymotrypsin. Now we are going to the last one. The last one is nothing but the small intestinal bacterial overgrowth. So there is a small intestinal bacterial overgrowth. So what does this include? So this in short is known as the SIBO, and this is nothing but the investigations to be done are due to Enterobacter or Pseudomonas jejunal aspirate. So this is greater than 10 to the power 3 CFU, and the other thing is due to other organisms, that is the jejunal aspirate. So this is greater than 10 to the power 5 CFU. So let's recap. So we saw about the small intestinal bacterial overgrowth. So this is nothing but the SIBO, that is SIBO. This is due to the Enterobacter as well as the Pseudomonas jejunal aspirate, that is greater than the 10 to the power 3 CFU, and it can also be due to the other microorganisms, the jejunal aspirate greater than the 10 to the power 5 CFU. Now we'll be going to answering our question. So the first question we asked was, in case of carbohydrate, comment on the carbohydrate malabsorption. So carbohydrate malabsorption is nothing but the investigation was the D-xylulose. So the D-xylulose test, and the second one was the lactulose, the lactose hydrogen breath test. Next, we are moving on to the pancreatic insufficiency. This was the second question we asked. So this includes the fecal elastase. It includes the fecal elastase as well as the fecal chymotrypsin. Now let's just recap. So we answered two questions, that is the carbohydrate malabsorption. So under this, it includes the D-xylulose test as well as the lactose hydrogen breath test. In case of pancreatic insufficiency, that is a specific test for malabsorption. So here there is the fecal elastase as well as the fecal chymotrypsinogen. To learn and grow daily, please do subscribe.